The topic that we are discussing today is diversity and family factors that's related to the autism spectrum disorder. So the objectives that we are going to be covering with this presentation is just a brief overview of the autism spectrum disorder, the cultural competency associated with autism spectrum disorder, the socioeconomic status of families related to autism spectrum disorder, bilingual families, urban versus rural populations, marital status, conflict and divorce, and then empathy. So we're going to go over just a brief overview of what those are, how those different diversity and just family factors relate back to the autism spectrum disorder, and then also go over some guidelines on how we can as professionals, how we can help guide parents in the right direction to get the services that they need for their child. So to start off, autism spectrum disorder, or ASD for short, is a neurodevelopment disorder. And with this, the way that we can define this is it's an impairment or restriction in social communication. That could be your reciprocal or your expressive communication. And it also goes along with unnoticeable repetitive behaviors such as hand flapping. That would include like your stereotypical behaviors that you see with autism. And there's a lot of other things that are associated with autism, and those common factors would be your intellectual disabilities. There's a lot of language disorder where you don't typically see kids with autism. They sometimes have a harder time developing language skills, and then sleeping problems, and of course anxiety and depression also come along with autism spectrum disorder, especially when you're thinking about the parental side of things. There's a lot of anxiety and depression that comes about with your child having autism. But in thinking back onto autism, the prevalence is a lot higher in males. Males tend to have, we tend to see males having autism over females. And then the prevalence between 2008 and 2018 actually increased from 1.1% to 2.3%. So you do see a good increase of the prevalence of autism within that 10-year time span. So cultural competency is basically just having an understanding while also appropriately responding to both the cultural variables and the diversity of the professional and clients. And it's very important to have cultural competency. And along with that, it also helps you to identify and understand your culture. It's also about having the knowledge and skills needed to be able to address an individual's culture and their language. And with this, having cultural competency in this stance, if you're able to understand and address your client's culture, their language, and the things that they need, it'll better help you provide the care that they're needing. So it'll better help you implement interventions. It'll better help them to see progress with the interventions. It'll help you to just develop a whole treatment plan for them. Also working with behavioral intervention plans and even developing IEPs for your clients. Having cultural competency is huge in this aspect. It's also the knowledge and skills will be able to evolve over lifelong learning, and it'll just, as you increase your knowledge with clients, with different clients and of different backgrounds and different cultures, you'll just be able to gain more skills, and it's just a lifelong learning. Again, it plays a big role in the diagnosis of ASD because it also helps influences reports from the parents. That helps you to get a better idea of the behaviors that are being seen And also it'll help you to not be able to have a cultural bias, and your judgment will be swayed because you're thinking that their culture is displayed this way and your culture is this way. But having a better understanding will help you see how the behaviors are seen from their aspect and your aspect. That way you can develop a good intervention to help address those behaviors. So with the socioeconomic status, it's very important to know the factors that are related with that. And we see that lower socioeconomic status, with the lower income families, they're seeing a greater number of barriers versus the higher income families. And those barriers include transportation issues, their work schedules, because they might be working, more than one job, have different time schedules to where they can't get their child into services because the services are not available during those times that you can get your child to service. Financial and insurance barriers. Again, finding the right insurance can be hard whenever you're in a lower income bracket, and also the financial aspect too. It's just hard to work everything out in that aspect. And also, if you're in a lower income bracket, you might have a limited knowledge of services that are offered. So you might not even know what services are available and are out there that can help provide like an early intervention, that can help provide speech, language skills, that can help provide occupational therapy, that can help provide physical therapy. There's a lot that could be hindering from knowing what services are there whenever you're in just a lower socioeconomic status. And also not being diagnosed until an older age. So again, you might not even know where the best to get treatment. You might not even know what the best avenues are to go about getting treatment. And then it's not found in your child until they're at an older age, when it's brought about up in school. And then early intervention is not really possible because they're already older. So again, it's just limiting factors with a lower socioeconomic status. However, there are some guidelines that we as professionals can help the lower socioeconomic status to be able to either get the services that they need, or just to have some overall like education on what they need to do. So, and of course, it's providing more information about services offered. So if someone came in and was having questions, you could definitely give them pamphlets, brochures, just having them things ready available for them so they can go out and get the services that they need. And then again, providing them info on financial services, just things that they can go out there to get the financial aid that they're requiring so they can get the services. And then just helping them to know more about what autism is, just giving them education on the different delays that can come about with autism, the different just how the stereotypical behaviors work with the autism, how someone with autism is different from a neurotypical child, just providing information to the parents so they can better know what autism is, and then they can better get the services that they need for their child, whether it's just, if it is early intervention, or whether it is just speech therapy, or if it is just occupational therapy, or if it is going into an ABA environment. That would be some great information to give parents in this lower socioeconomic status, because they are seeing far greater barriers than the higher socioeconomic status, because with them in the higher socioeconomic status, they're getting more opportunities for services. They're getting more information about services, and they have the financial support that they need to actually acquire the services. So there's a lot of barriers that are coming within this socioeconomic status that we as professionals can definitely help to give out that information that is needed in the lower socioeconomic status. Now, when looking at bilingual families, they're becoming more common among families in the United States. With that being said, the number of children diagnosed with autism among those families are increasing as well. And also, the majority of them are in the lower socioeconomic status and have difficulties getting a diagnosis. And one common belief that the parents in bilingual families have is that it might be confusing for their child to learn 2 different languages, so oftentimes they do not teach your child 2 different languages. However, in the article that I found, and I've attached the citation for it here, it stated that it is not confusing actually for the children to learn 2 different languages. That is just like a common misbelief that is associated in bilingual families. And also another concern that bilingual families have are the lack of services that are provided as well as lack of support given. They tend to find that they're not getting the support that they need as well as getting the services that they need, and that's a big issue in bilingual families that is becoming more and more prevalent. So continuing on with bilingual families, some guidelines that we can use and go about with helping them get the services they need and helping them just in general. So they do have several concerns, as was mentioned in the previous slide, and here are some ways that we can help them by providing information on services that can be offered to them. So definitely giving them information and also addressing their culture as well, like looking into their bilingual, like what language they speak. And the different cultural backgrounds like that will help you guide them in the right direction into getting services by providing them with information that's in their language, by providing them with information and the services that are close to their location. And also addressing their concern about speech. That is something big that we can do, and providing them with information on to speech therapy. And then just showing empathy towards them. I know that's like a big thing which we'll cover later, but empathy is huge when you're dealing with any type of family, but the way that the diversity is here is that having empathy towards them and just having the compassion and understanding that, hey, like just understanding their situation and trying to place yourself in their shoes, that's what we need to offer for them, and that will help in big ways. And another concern that needs to be brought up is urban versus rural populations. So the rural populations are finding it more challenging to obtain services, and this is primarily due to their location. There's not a lot since mostly the rural population is out in the country, they're out far away from the big cities. It's harder for them to get the services that they need, while also parents are having a hard time getting a diagnosis as well, because one, they're not sure of where to go get a diagnosis, they're not sure of how to get a diagnosis, and they're just lacking some of the information that's needed about autism. And it's very, very difficult for them because it's not that they don't want to get services, it's just they have limited services, and they have inaccessibility to those resources that they're needing. And one, it might be a far drive for them to go out to a location that would provide services. So there's definitely the rural population is having is seeing more challenges in the urban population in getting services. Not necessarily that it's trying to find the financial support for the services, it's just trying to get the services themselves just because they live so far away. So continuing on with the urban versus rural populations, one big thing that is a challenge for the rural population is the school system. So there is a act, it's the Individuals with Disabilities Education Act, and that is an act that helps anybody with a disability get the services that they need in the school system. However, 98% of the school systems are having a problem getting those services to those individuals who need it. One, it's because they're lacking staff that is qualified to give those services, and they're having a hard time finding people that want to do that in the area. So because the rural population is having a harder time than the urban population getting the services in school like that. And that's just one big way that the rural population is facing a lot of the challenges versus the urban population. So some guidelines that we can follow to help the rural population. One, we can help locate facilities that can provide support. So just by being there and guiding the parents in the right direction to finding a place that can provide support will help out tremendously, while also educating the parents on what autism is, just helping them to realize the different aspects of autism, helping them to realize what the stereotypical behavior is, what type of things we're looking at that encompass autism, and also the teachers as well, going into the school systems, helping the teachers understand how to work with children who have autism. That is a huge step and some guidelines that we can use. And also helping implement parent-mediated interventions. That is huge as well, because they're in a population that doesn't have access to a lot of the services just because of their location. It's best to help the parents to be able to implement interventions so that their children can get some of the early interventions that they need and just some of the help that they need. And then just overall, just bringing awareness to autism and the services that are available. Again, just helping the parents understand when they're looking at their child what things to be aware of and what things that they can do to help them. And then again, just helping them with the financial services, the location of services, just helping them to actually run interventions. Those are some huge guidelines that will help these parents, help them to help their children grow and make progress. So another thing that we can look at in diversity is marital status, is conflicts within the marriage and divorce. So one big issue is that parents who are raising a child with autism tend to face many problems that put a strain on their marriage. One of those problems is, of course, not knowing when and if a diagnosis will be given. That just puts a lot of uncertainty into their life, and it just makes their life unstable, not knowing what's going to happen to their child. Also, realizing that autism is a lifelong disability, that their child will live with autism for their whole life, that they will be helping their child who has autism for the majority of their life, just being there as an extra support for them when they need it. But that is huge, is just because the realization sets in, especially once a diagnosis is given, and then having different viewpoints on how to raise the child. Because one parent's thinking that we should do this, the other parent's thinking that we should do this, and they're just bringing in different viewpoints. They're wanting to provide this service, they're wanting to go this direction, just bringing a lot of stress into their life. Can really put a strain on marriages. And then, of course, having grief about, well, the capabilities of what their child can and can't do, that puts a lot of strain on the marriage as well. So some guidelines that we can follow for marital statuses and conflicts in marriages and divorces is, of course, just providing support as needed. I know that there's going to be a lot of uncertainty, there's going to be a lot of issues that come up, but just being there to be support for them is huge. And also just being sure to answer your questions that you're giving to them honestly, telling them everything that they need to know and not just telling them what you think they need to know. And then being sure to explain everything in terms that they can understand, because some terms that we know that we've been using for a long time, they might not have any idea of what those terms mean. So just making sure that you explain everything in ways that everybody can understand. And of course, providing guidance when they come to you looking for advice. So of course, having different things that they need, information on things that they need, just making sure that you have all the information for them. And lastly, showing respect to their concerns, just making sure that you're there and you're not being disrespectful to them. And then lastly, talking about empathy. It's definitely a great idea to show empathy when you're dealing with anyone in any situation. Definitely when it comes to diversity, we need to make sure that we have everybody's understanding of your client's needs, understanding of your client's culture, understanding of the language that they use, understanding of ways that you can help them, and just showing that you're invested in the conversation and not that you are just there to pass time, just there to do a job, just showing that you are there and you are concerned, that you care about them, that you want to help them. And just never being blunt either. Just making sure that you answer everything the way that you're supposed to answer it. Just make sure that you're actively listening, actively showing support, actively showing that you care, and not being blunt with any responses, as will go tremendously with any family in any situation. And being considerate of your tone and explanation. So just making sure that you have a caring tone and that you're not just, it doesn't seem like you're coming off as disrespectful, and that you're there for them and you're trying to put yourself in their shoes, because it's definitely difficult in any situation when you're trying to find services, trying to get the help that you need for your child who has autism. It's definitely challenging and it puts a strain in a lot of different situations. So just making sure that you're considerate and that you make sure that your tone is considerate and that you explain everything the way that it needs to be explained. So here are the references that I used for this presentation. Each slide has the citation of the article that I used to gather the information from. And these articles dive deeper into the different aspects of diversity that I was looking into. And these are great articles to look at and to read even further into.